And what is said, it's lesson learned. And when I talk about lesson learned, I can start with my first slide. What we can see is that we have every year, we still have sudden cardiac arrest, even if we do the best PCMA in Germany or in Europe or in UEFA competitions. And the reason is why we have some players which have a sudden cardiac arrest, which we cannot detect before. We don't know why they fall down. But what we know is most of the time what they have is not a sudden cardiac arrest. It's better called a sudden circulation arrest because the heart is still working. So what we have is a rhythm problem. And when we talk about rhythm problem, the good thing is when we talk about rhythm problem, you can solve it very easy. It's not like a myocardial infarction where part of the myocard is already gone and you do resuscitation and the outcome is not that good. But if you just have a circulation problem caused by a rhythm problem, we can save these people. This is very easy. Here you can see a timeline. If we do the resuscitation within the first 2 minutes, they have a survival chance of nearly 90 minutes. So this is a question when we talk about sudden cardiac arrest on the pitch, because we don't often have a good outcome. We don't often have, like in Eriksson's case, that the people survive. We have a lot of dead people on the pitch where actually we know we could have saved them. And this is a lesson learned. And I started with it, let's say, when I was watching football 2004, 2005 with Miklas Fehr and Marc-Vivien Foé collapsing on the pitch, or where the TV was on it. And I, as an emergency doctor, and I was the director of an emergency school where I trained emergency doctors and also paramedics. For me, it was like, oh, come on, go. And then I realized we have to train them. Why it's not working well. And there I could face 3 things. At the beginning, we had not the right equipment on the pitch. Right now, the times changed, and I think especially after Eriksson's case, I think nearly all professional football teams have a defibrillator on the spot. They have it with them during the match and during the training. This is important. If we want to resuscitate, we have to do it in the first 2 minutes. So we need to have the equipment with us. The second thing is the persons on the spot. Even if there was equipment, I could focus that these people were not trained how to do it, how to do a resuscitation. So training is very important. And then even this, we started with the training and the education quite early in Germany. I think since 2007, something like this, we already trained pitchside doctors, and we also trained the physiotherapists and the medical doctors, team doctors from the clubs. But we still had some cardiac arrest on the pitch where the start of the resuscitation was not on time. So in this is, when I watched a lot of videos, I could see why is it like this, and then I realized, okay, the recognition of an eyewitness sudden cardiac arrest is something special, and this we have to tell the people, and this we have to show the people. So when we talk about lessons learned, what you need is equipment. So what I said before, and for the resuscitation on the pitch, it's a basic life support. It's a basic life support. We even don't need at the beginning medication. For a successful resuscitation, we only need 2 things. Actually, with our hands, 3 things. We need someone who can do a chest compression. We need equipment. We need an AED on the pitch side, and we need airway management. That's all we need at the beginning, because in the first 2 minutes, we even don't need any medication to give it. We can start with a chest compression and we can defibrillate, and if we do it fast and quick, then we can survive. The player will survive. What Morten already said, we need to train the medical team. It's not only that you need the equipment, know your tools. You must know how a defibrillator works. It's not when you have the event, when it happens on the pitch, it's too late to learn how a defibrillator is working. So we need to train the people who are the first on the spot. And these are the physiotherapists, and this is the team doctors. So they need to be trained, and they have to know their tools. They have to know how the defibrillator is working. And of course, the chest compression. If we do chest compression, it must be done correctly. If you don't do it correctly, it's worth nothing. So we have to train on the dummy. We have to train with the defibrillator. We have to train the people who are working together with the team. It's very important. And what I said as a coach of the emergency and paramedics, we call it mega co-train. You have to create an emergency team, and this can be done with 2 people only. And when you're going through, because what was said before, the situation is so stressful for you that your brain will definitely not work proper. So what we need to have an automatism, and this automatism you can only create when you follow a mega code training, when you know what is your position, what is your role, and then you can, even without thinking very much, you can start it. Because most of the problem, what we can see on the pitch, is a denial. It can't be. It has never been before. I have never done it before. In 99%, I run on the pitch because it's a muscle injury or whatever. But the denial of a sudden cardiac arrest is there. And then you have to know every collapse on the pitch without body contact is a sudden cardiac arrest. Don't think about anything else. Start with the chest compression. And we had in the I think it's just a few months ago, we had a player collapsing, or it was a goalkeeper collapsing on the pitch, and the team doctor and physiotherapist run on the pitch, and this player was unresponsive, and so they started the chest compression. They missed that this player was collapsed because he was hit before on the head, so it was a concussion of the chest. It was not a sudden cardiac arrest, but I think they did it perfectly because they didn't see the contact. They just run on the pitch and they saw someone who is unresponsive, not moving, not reacting anymore. So they started the chest compression, and this is also lessons learned. This is the best decision in this moment you can do, even if it was not a sudden cardiac arrest, but they started it. If it would have been a sudden cardiac arrest, they would have saved his life. So, and this is one video I want to show you. I hope it's running, because this video shows actually what I can see in nearly every single video. When I started, you can see it. You can see here on the left side, this is Abdelak Nouri, 19 years old, collapsing on the pitch. And now the first reaction is, when you can see it, he's collapsing, but he's still moving and he is still breathing. And this is quite normal for an eyewitness sudden cardiac arrest. The people can move for 20, 30 seconds. They still can breathe for 20, 30 seconds, but he has a circulation arrest. Okay, so it looks not very dramatic. Team doctors are running on the pitch, very easy. They notice he's unresponsive. They notice, but he still has a nice color. He had moved. They saw him moving. So they saw him breathing, and so they are not aware that this is a sudden cardiac arrest. And but the next step is, after 20, 30 seconds, he stops with the breathing, and his color changes. He became hypoxic, and then this is always a misinterpretation. If someone becomes hypoxic, they think he cannot breathe. So what they do is they focus on the tongue, they focus on the head, and they think he cannot breathe, he cannot breathe, he cannot breathe. And so they are busy with the airway management. But this is now when we count on the time now, when I said, if we want to save his life, we should do the resuscitation within 2 minutes. They should have started here now. And the other thing, what you can see is we have the field of play team with them. We have on the spot, we have a defibrillator, we have an emergency bag, and we have a field of play teams. But what you can see, hectic, hectic, hectic. So the reaction, it was then too late to save his life. But this is something, what I said, we can always see. And this is also, again, lessons learned. What I can see on all the videos, and what I've seen so many times when I'm responsible as a as a medical doctor on UEFA tournaments or in the German Bundesliga, you always have to check. We have a field of play team. If you really want to do it good, it has to be checked that the equipment they have is correct. Because what I said, these are just two examples, what we really have seen. When we had a UEFA matches and you go there and you ask for medical equipment and you ask for a spine board and suddenly they present here on the left side something like this. This is definitely not the spine board. And I had it already 2 times that they presented me a defibrillator, which was actually a dummy. It was a training defibrillator. So you cannot save someone. So this is something what you need. You need to have minimal medical requirements, and you have to check the minimal medical requirements every time you are on during a match or during the training. Is it working? Is it okay? Is it really? You cannot rely on other people. Even if you have a field of play team, don't always think that these people are really experienced or in resuscitation. So the best is a training that you are trained as a team doctor or physiotherapist. You know how it works, and you must create an emergency team that you can work together, and then you can solve it easy. And believe me, for me as an emergency doctor, these are candies if I can resuscitate someone who only has a rhythm problem. And I'm there, I'm on the scene. It's not that I come there in 5 minutes with an emergency car. I can save their life very easy. You just need your equipment and you need your hands, and you need to be self-confident. Just do it. Even if the decision was not right, it is at the end, it is right. Thank you.